Welcome back to our COVID conversation with local doctors. You just heard about COVID and pregnancies, along with misinformation, including even in hospitals. So now we turn to the Delta variant and children. There's an alarming spike in COVID cases among children. According to the American Academy of Pediatrics, the U.S. reported nearly 94,000 new child COVID cases in the last week. An alarming spike in coronavirus cases among children in the last week. The U.S. reported again, that's the 94,000 number for pediatric cases. That's a 143% increase from 2 weeks ago, and the highest number of pediatric cases reported since February. This comes as a fight escalates over Republican-led efforts to ban protective measures like mask mandates in schools. Some school districts are defying those orders. Let's turn things over to our panel now. FIU infectious disease expert Dr. Marty, Dr. Perlyn of Children's Hospital, and Dr. Johnson of Baptist Health. Thank you so much for being with us. Dr. Marty, once again, let's turn things over to you. We're dealing with this Delta variant. Obviously, with the vaccines not as widespread as many experts had hoped, there could be the potential for more variants as well. How is this particularly impacting children under 12 who cannot be vaccinated right now?
So children under 12 need to have the protection of the people around them, and that the people around them be vaccinated. And I think it's very important for people to understand that this Delta variant has a number of mutations and deletions, including one called the P681R. That mutation allows the virus, once it's infected one cell, to pass directly to another cell by fusing the cells together. That means that that virus can evade some of the immune protections that people may have. And because of that, it's really, really serious to understand that it's very important to be vaccinated ahead of time to already keep the virus from getting into the first cell.
Wow, it sounds like almost the virus is getting smarter. Dr. Marty, thank you so much. Dr. Perlyn, now so many say that they'd rather just take their chances with COVID, that the survival rate is high, but some of those survivors are actually now dealing with something known as long-haul COVID. What are some of the symptoms that you're seeing that they're dealing with, and is there anything that they can do to help reduce these issues?
Yeah, long-haul COVID is very real, and we certainly have seen it in the pediatric population, and we've seen it here in patients in Miami. Long-haul COVID syndrome is defined as when symptoms persist much longer than we would anticipate, oftentimes 12 weeks or even beyond. And it's typically fatigue and severe fatigue, shortness of breath, and mental confusion, or what some parents or children call a fog. And so that's something that we are deeply concerned about. Although the chance of getting it is low after having COVID, for those families and children who are affected by it, it's very real, and there's not much we know at this point about how to effectively treat those long-term symptoms.
Scary symptoms for adults and especially for children. Now, Dr. Johnson, masks in schools, obviously a hot topic of late. Broward approving its mask mandate, Miami-Dade considering one of its own, all against the governor's wishes. Now, some parents, though, are against the mandate because they say their children have trouble breathing or that the masks collect bacteria. What's your response to these types of concerns?
Well, you know, I won't debate the governor's policy of having parents have, you know, that pro-choice policy. But what I will say is that I believe that parents need to choose wisely and to choose to protect their children. And we know, after having 18 months of dealing with this pandemic, that the first thing we want is for people to be vaccinated. So anyone 12 or older should get vaccinated. For those children who are under 12, and that's, face it, most of the children who are in elementary school, they cannot be vaccinated. And what the CDC guidelines are is that if you are in a community where the virus is surging, and certainly Miami-Dade County, the virus is surging, we have a high transmission rate right now, so we fit that category. So if you're in one of those communities, you should mask when going indoors, whether or not you've been vaccinated. But certainly our children who've not had the opportunity yet to be vaccinated need to be protected, and they should be wearing a mask. So if those parents have a choice, they should choose to protect their children. They should choose to protect our community, and they should choose to protect their children's education. because we know that last year our children's school year was totally disrupted. And if a child gets COVID in a classroom or is suspected of having COVID, there's going to be disruption. There's going to be classes that are likely sent home or, put on quarantine, and that can be avoided if everyone in the classroom is wearing a mask. So that would be my advice, is that you wash your masks on a daily basis, you use a different mask every day, and that will help protect them from some of those concerns that you raised.
Good advice there, Dr. Johnson. And just want to wrap things up with one more question. Dr. Marty, I'll direct this one to you. A lot of people have said, well, I don't want this vaccine until it is FDA approved. Right now it has emergency use authorization. What is the timeline as far as FDA approval? And what are you hearing as far as the potential for booster shots for all?
So that's a lot of questions in one, but let me start with the science is already there for the safety and efficacy of the vaccine. It's a matter of timing for the meetings and going over all the data and dotting every I and crossing every T. But the science is clear. The vaccines have all the requirements scientifically to meet the qualifications for the Pfizer and the Moderna to get full FDA approval. And so as soon as they get together and finish going over the paperwork, you can see that these vaccines will be approved because they have met the criteria.
And we'll see how that impacts those vaccination numbers. Yes, please. In terms of the booster shots, Dr. Marty?
Yeah, so the science there is also very clear as well. And our experience now with people who have certain underlying conditions that make them very immune deficient or unable to mount a really good response, and of course some elderly individuals, there is indeed a need for a booster. We've seen it. That's why Israel is doing it. That's why Germany and France plan to do it starting in September. And I predict that the CDC will also make that recommendation for the boosters for certain select members of the community.
Such vital information for all of South Florida to know. Dr. Marty, Dr. Perlyn, and Dr. Johnson, thank you so much for being with us tonight for this important discussion on COVID in our community. And a reminder, if you need to find vaccination or testing sites, just download the CBS Miami News app from the App Store or the Google Play Store. We've also posted all the locations on our website, cbsmiami.com. We'll be right back.